How do you fix a baby's latch? You have a baby who's biting, you have a baby who's cracking your nipples, you have a baby who is making clicking sounds or spitting up all over food, and you have no idea what to do. How is a chiropractor going to fix any of that? In this One Belly, Two Brains, what I'm going to answer for you is the real simple techniques that we use in order to help babies who are having latching issues. It's important to understand that we treat moms and babies as a dyad. So first off, it's also understanding that mom is clear, that she has a good line of communication between her brain and the breast tissue, that the sensory information coming from her body is able to communicate through the top part of her neck, where they meet the shoulders, and up into the brain where the hormone prolactin gets made. It's a signal to refill for milk production, making sure that she's free and clear. And once we know that that supply issue is also good, then also looking at baby and how a couple things work. There's something that we call as a shortcut JET, jaw, eye, and twisting or turning the head. So if we have a jaw that's off to one side, we have kind of like a pirate eye, a little torsion, facial cranium, a twisting or turning of the head or neck. Those are all signs that we've got cranial distortion going on in there for the baby. There's a couple other things that we look for. So if a baby is having a gap when we put our little finger in their mouth and check latch, if the baby's biting me when we do that, or if I'm looking at the top part where the tissue attaches from the lip into the top of the gums, and that tissue is down about halfway down the gum line or further, it's piercing the palate especially, that's a flag. And if a baby sticks the tongue out and we see a little heart shape in there for the tongue, those are all things that tell me that we've got something like tetheral tissues or perhaps some cranial misalignment that we need to address. So the way that we do that is actually really gentle. I've been able to do this with some babies and they sleep through the whole thing. So they come in, sleep in a car seat, we adjust them upper cervically, which is some real gentle pressure. It's about the size of, I think of a real ripe tomato, putting your thumb on it before you push through the skin. That's about the size of pressure that we use on a little baby. And so the same is true on the inside of their mouth. We'll put a little rubber finger cot on and I'll go ahead and feel. So what you can't see when my finger is inside the baby is what I'm doing. There's three main things that I'm checking for. First thing that I look for is a palate. And I want to make sure that the roof of the mouth is even. I want to make sure that the neuron that triggers the gag reflex is also far enough back so the nipple isn't hitting it and the milk shooting in there and all of a sudden the baby's choking. If that neuron needs to get desensitized a little bit, one of the big times where I'll recommend certain pacifiers. It's actually one of the few times I'm like, yeah, go for it, because we need to help teach that neuron that it needs to be a little further back so the baby isn't gagging and choking. Second thing that I'm looking for with that palate is evenness and what kind of like dome is sitting in there. It shouldn't be too high, shouldn't be too flat. That bone is actually connected to other bones that go all the way up into the top of the head. And if we can help those move a little bit better so that we have a good even palate, and that really helps the baby be able to put the tongue up in there too. The next thing that I'm checking for has to do with the jaw. So this is a two-part thing that I'm looking for. The first one is a set of like ligaments and muscles that attach on the inside of the jaw, and then another set that attach on the outside of the jaw. And so that set of muscles, they're called the pterygoid muscles, the medial and the lateral pterygoid. It starts with a P, like pterodactyl, in case you want to look it up on an anatomy illustration. Sometimes they can get tight. If the baby has to pass through a birth canal or gets flipped around the other way and has to pass through the belly, doctors make it the smallest incision they can, and often they use that mandible as kind of a little torsion point. Sometimes the jaw can get hung up as the baby's passing out. So we get a strain in there. So I'll feel for spasm, feeling for tightness and restriction in there. And basically all I'm doing, again, using that tomato analogy, is just holding with pressure until that fascia starts to unwind on my finger, and then the baby can open up a little bit broader. The last thing that I look for is, as I mentioned, upper cervical reflexes. So right up here where the head meets the neck, we have a set of reflexes along the brainstem that help with nursing. And if some of the suck and swallow reflexes aren't working really well, that is one of the first places that I'm looking for. So I'm looking for subluxations or misalignments where the head meets the neck. And if I feel like the vertebra is sticking over to one side, there's so much space in the vertebra, I don't need much pressure in order to put it back. This isn't like cracking a glow stick like you're a grown-up, right? This is real soft, gentle, mostly cartilage tissue in there that needs to move. So we can do that with just some fingertip pressure. Being able to do that is a really simple move. Again, I've had some babies sleep through the whole thing. you want to look at our Instagram feed, you can actually see me doing that for a baby. It's when I really got my ninja skills on. I can also do the cranial stuff, like the intraoral stuff as well, and have that baby sleep the full way through. So something I always like. It's a good challenge for me. I've got a baby that's got some latch issues, and it's like, all right, game on, here we go. Um, like I said, the ways that we know then that we've got a functional latch, something that's able to be corrected through chiropractic care, is that usually that latch is then better for a while. We're talking like a day or two. If, however, that latch doesn't get better, like it's better that next feed, but then 20, 30 minutes, it goes back to the way that it is, and those tetheral tissues probably need to be released. And that's how I make my differential between something like this is a chiropractic case, maybe we need to co-manage with pediatric occupational therapy or pediatric dentist. So if you have questions, if you have people who have been in your life who've had nursing issues, if you yourself are struggling with one, leave me a question in the comments. I'd love to read those things. Also, make sure that if you have people that you think are struggling, share this video with them. It's a real easy way, because sometimes it's just about knowing that you're not all alone, you're not crazy, you don't have to just grin and bear it. You don't have to grit your teeth through this. Nursing doesn't have to be super, super painful. I don't want to mansplain that, right? I'm never going to know what it's like to nurse a baby. But what I do know is the experience of literally thousands of moms that helped, and what they tell me about the difference that chiropractic care has made in their nursing relationship. So we come to you on One Belly, Two Brains on Facebook. We do that on Instagram TV, and we also do it on YouTube. So if you have the opportunity to watch this, make sure you also follow us, give us a thumbs up. That helps us with being able to reach more parents. And I'll look forward to answering your comments